10 foods you should never eat if you have arthritis. Arthritis, which is characterized by joint pain and inflammation, affects millions of people worldwide. With over 100 types of arthritis, including osteoarthritis, rheumatoid arthritis, and psoriatic arthritis, it is a condition that can significantly impact people's lives. These conditions vary in causes and symptoms, but commonly lead to joint pain, stiffness, and swelling. Managing arthritis often requires a multifaceted approach, including medication, physical therapy, and lifestyle changes, particularly dietary modifications. The relationship between diet and arthritis is complex and significant. Certain foods have been shown to worsen inflammation, a key factor in arthritis pain and progression, while others may have anti-inflammatory effects. Understanding this relationship is crucial for individuals looking to manage their arthritis symptoms effectively. This video focuses on 10 specific foods and food groups that individuals with arthritis may benefit from avoiding. These recommendations are based on scientific research and clinical observations regarding how diet can influence inflammation and arthritis symptoms. 1. Sugar and refined carbs. Sugar and refined carbohydrates are among the primary culprits in promoting inflammation. Foods like candy, pastries, sodas, and white bread cause a rapid spike in blood glucose and insulin levels. This spike can trigger the body's inflammatory response, aggravating joint pain and swelling. Moreover, high sugar intake is often linked with obesity, which can put extra stress on the joints, particularly the knees, hips, and spine. Reducing sugar intake is not only beneficial for managing arthritis, but also for overall health, reducing the risk of obesity, heart disease, and type 2 diabetes. 2. Red meat and processed meats. Red and processed meats like beef, pork, sausages, and deli meats are high in saturated fats. These fats can increase the body's inflammation, particularly in people with conditions like rheumatoid arthritis. Additionally, processed meats contain high levels of advanced glycation end products, harmful compounds formed when these foods are cooked at high temperatures. Ages can heighten oxidative stress and inflammation in the body. Studies have shown that diets high in these types of meats are associated with an increased risk of developing inflammatory arthritis and worsening symptoms in those already suffering from the condition. Eating lean meats, such as chicken or turkey, and increasing plant-based proteins can be a healthier alternative. 3. Fried and processed foods. Fried foods like French fries, donuts, and processed snacks contain trans fats, which have been phased out in many countries due to their harmful health effects. However, they can still be found in some processed foods. Trans fats increase bad LDL cholesterol, decrease good HDL cholesterol, and promote inflammation. A study published in the American Journal of Clinical Nutrition found that reducing the intake of these foods significantly reduced levels of inflammatory markers in the blood. Swapping fried and processed foods for natural, unprocessed options, such as fresh fruits and vegetables, can positively impact arthritis symptoms and overall health. 4. Gluten and refined grains. Gluten, a protein found in wheat, barley, and rye, can cause problems for people with celiac disease or gluten sensitivity. In such individuals, gluten triggers an immune response that can worsen inflammation, including in the joints. Furthermore, refined grains, even gluten-free, are high glycemic index foods. They can raise blood sugar quickly, leading to an inflammatory response. A Journal of Nutritional Biochemistry study indicated that a gluten-free diet could reduce pain and inflammation in individuals with rheumatoid arthritis. However, it's important to consult with a healthcare provider before making significant dietary changes, as gluten-free diets can lack essential nutrients if not well planned. 5. Dairy products. Dairy products can be problematic for some individuals with arthritis. The type of protein found in dairy, particularly A1 casein, can lead to inflammation in susceptible individuals. This response can worsen arthritis symptoms. Additionally, some studies have suggested a link between dairy consumption and increased risk of rheumatoid arthritis, though more research is needed in this area. Alternatives to dairy, such as almond, soy, oat milk, and cheese, made from these alternatives can be good options. These alternatives often provide similar nutritional benefits without the inflammatory effects. However, choosing unsweetened and unflavored versions is important to avoid added sugars and chemicals contributing to inflammation. 6. Alcohol and tobacco. Alcohol consumption and smoking are known to have numerous negative health effects, and their impact on arthritis is no exception. Alcohol can increase inflammation throughout the body and can interfere with the effectiveness of certain arthritis medications. Excessive alcohol consumption has also been linked to gout, a painful form of arthritis. Similarly, smoking is a significant risk factor for the development of rheumatoid arthritis and can worsen its symptoms. Smoking also affects the circulatory system, reducing blood flow to the joints, potentially increasing joint pain and delaying healing. Reducing alcohol intake and quitting smoking can have a profound positive impact on arthritis management and overall health. 7. Salt and preservatives. Excessive salt intake concerns blood pressure and can also affect arthritis symptoms. High salt intake can increase water retention, swelling, and joint pressure. Additionally, many processed foods contain preservatives and additives that can trigger inflammation in the body. Foods high in preservatives, such as prepackaged meals, canned foods, and certain snacks, should be consumed in moderation. Opting for fresh, whole foods and using herbs and spices for flavoring instead of salt can help reduce overall salt intake and alleviate arthritis symptoms. 8. Certain vegetable oils. Some vegetable oils, particularly those high in omega-6 fatty acids like corn, soybean, and sunflower oil, can promote inflammation when consumed in excess. These oils are often found in processed foods and used in cooking. While omega-6 fatty acids are essential for health, an imbalance with omega-3 fatty acids can lead to an inflammatory response. Increasing the intake of omega-3 rich foods, such as flax seeds, chia seeds, and fatty fish like salmon and mackerel, can help restore this balance. Cooking with oils with a better omega-6 to omega-3 ratio, such as olive oil, can also be beneficial. 9. Artificial sweeteners. The impact of artificial sweeteners on inflammation and arthritis is a topic of ongoing research and debate. Some studies suggest that certain artificial sweeteners may trigger an inflammatory response, particularly in individuals sensitive to these compounds. These sweeteners are in various products, including diet sodas, sugar-free candies, and other low-calorie or diabetic-friendly foods. While more research is needed to understand their effects fully, individuals with arthritis may benefit from limiting their intake of artificial sweeteners and opting for natural sweeteners like stevia or small amounts of honey. 10. Foods high in advanced glycation. End products. Advanced glycation end products are harmful compounds formed when protein or fat combine with sugar in the bloodstream. They are particularly prevalent in foods grilled, fried, or roasted at high temperatures. High levels of AGEs in the body can lead to oxidative stress and inflammation, worsening arthritis symptoms. Reducing the intake of foods high in AGEs, particularly charred meats and fried foods, can help manage arthritis symptoms. Cooking methods such as steaming, boiling, or stewing can reduce the formation of AGEs and are healthier options. In conclusion, diet plays a significant role in managing arthritis. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins is generally beneficial for managing arthritis. Regular physical activity, maintaining a healthy weight, and staying hydrated are important aspects of managing arthritis. Thank you for watching the video. Please share it with your family and friends so that they can benefit from it. Please subscribe to our channel to watch interesting videos on health topics.